Everyone, welcome back to my channel. Today we are going to discuss about the previous question papers related to Aiims-Norcet. So this is the paper from the year 2023. So we are going to do just as a mock test. We are not going to explain in detail. Okay. So shall we start the video? Let's get started. First question. First question, the causative agent of Lyme disease. So the options they have given: Rickettsia prowazekii, alpha virus, Borrelia burgdorferi, Trypanosoma brucei gambians. Did you find the answer? It's an option 3, Borrelia burgdorferi. Second question, which among the following is the sign of severe dehydration among infants? So the options they have given: anxiety and increased skin turgor. Second, drowsiness, depressed fontanelle and decreased skin turgor, excessive crying and excessive thirst. And fourth option, drowsiness, bulging fontanelle and decreased skin turgor. What are the signs of severe dehydration among infants? Did you find the answer? So the answer is 2. Drowsiness, depressed fontanelle and decreased skin turgor. Third question. Which option describes orthopnea? So the options I have given: ability to breathe only in upright sitting or standing position. Second, slow breathing. Third, difficulty in breathing. Fourth, rhythmic waxing and waning of respiration. The answer is option 1, ability to breathe only in upright sitting or standing position. Fourth question, the obstacle assessment of the reveals. So obstacle assessment you have to find out. So here what they have given, this is her third pregnancy. Her first child was delivered at 38 weeks. Her second child was delivered at 34 weeks. So calculate the GTPAL score, that is gravida, term, preterm, abortions, live births. So here the options they have given: 31101, 31102, 31111, 32111. Means how many gravidas, terms, like that. The answer option 2 is the correct answer, that is 31101. Fifth question. Patient arrived at an emergency department after a road traffic accident. Pulse rate is 127 beats per minute. Blood pressure is 90/60 with cold extremities. The nurse understands that the patient is at risk of which type of shock? Okay. So the options they have given: neurogenic shock, hypovolemic shock, spinal shock, cardiogenic shock. Which type of risk there is? Which type of shock? So the option 2 is the correct answer, that is hypovolemic shock. Sixth question. When examining a patient who is paralyzed below the T4 level, so the medical surgical nurse expects to find. So the options they have given: impaired diaphragmatic function requiring ventilator support, flaccidity of the upper extremities, independent use of the upper extremities and efficient cough, hyperflexia, hyperreflexia and spasticity of the upper extremities. When the patient is paralyzed below the T4 level, what uh, findings you will expect? The option 2, flaccidity of the upper extremities. Sixth question, contraindication of liver biopsy is. The options they have given: diabetic condition of the patient, decreased activated partial thromboplastic clotting time, that is APTC, then increased activated partial thromboplastic clotting time, or immunocompromised patient. What is the contraindication of liver biopsy? The option 3, increased activated partial thromboplastin clotting time. Eighth question, normal blood pressure of the adults. I think everybody knows it. So the options they have given 120 by 160 mmHg, 120 by 80 mmHg, 100 by 70 mmHg, 140 by 90 mmHg. Hg means mercury. So the answer 2, 120 by 80 mmHg. Option 9. The most preferred site of administration of IM injection in children under 1 year is option dorsogluteal site, vastus lateralis, ventrogluteal site, deltoid site. This already we have discussed in the previous videos. Correct answer option 2, vastus lateralis. Question 10. The below shown instrument is used in which surgery? This instrument used in which surgery? The options they have given: thyroidectomy, abdominal surgery, thoracotomy, cesarean section. I think you have seen the answer. So the correct answer is thyroidectomy. 11th question. The mask shown in the image is known as. So this mask which here it is showing is known as. So the options they have given: nebulization mask, simple facial mask, non-rebreather mask, Venturi mask. What type of mask it is? The answer option 3, non-rebreather mask. So 12th question, when serum bilirubin level rises on 3rd and 4th day after birth of the baby due to inefficient hepatic function is known as. So the options they have given: pathological jaundice, obstructed jaundice, physiological jaundice, viral hepatitis. When serum bilirubin level rises 3rd and 4th day after birth of the baby, what we call it is? The correct answer 3, physiological jaundice. 13th question, which of the following drug is prescribed to an antenatal mother for fetal lung maturation? So the options they have given: bromocriptine, metoprolol, betamethasone, metoclopramide. Direct question. Answer option 3, betamethasone. 14th question, which of the following medication is administered sublingually for managing angina pectoris? Aspirin, betalol, nitroglycerin, warfarin. Which medication is administered sublingually for managing angina pectoris? The answer option 3, nitroglycerin. Question 15. The reference point for the measurement of JVP, jugular venous pressure, is the suprasternal notch, sternal angle, sternum, nipple. Where, which site we will measure the jugular venous pressure? The option 2, sternal angle. 16th question, if a nurse evaluates the ECG and sees a saw-toothed P-wave, what will be the diagnosis there? The options they have given: atrial flutter, premature junction complications, atrial fibrillation, nasal arrhythmias. The answer option 1, atrial flutter. 17th question, non-stress test is said to be normal if there are 2 or more FHR accelerations during a 20-minute period, 2 or more FHR accelerations in a 40-minute period, no decelerations during a 40-minute observation, and no accelerations during a 40 minutes observation. When we will call it is normal, non-stress test? The answer option 1, 2 or more FHR accelerations during a 20-minute period. 18th question, apical pulse can be assessed at. So the options they have given: at second intercostal space in the left midclavicular line, between second and third intercostal space in the left midclavicular line, between fourth and fifth intercostal space in the left midclavicular line, between fifth and sixth intercostal space in the left midclavicular line, where we will assess the apical pulse. The correct answer, fourth option, between fifth and sixth intercostal space in the left midclavicular line. 19th question. What should be the ideal ratio of cardiac compression and respiration during CPR in a child? So the options they have given: 3:1, 15:2, 5:1, 1:1, and this is most frequently asked question. So what is the ratio of cardiac compression and respiration during CPR in a child? I think here they have given the wrong option, because if it is a single respirer, they will give the 30:2 ratio. If it is a double rescuers will be there, means 15:2 ratio will be there. So I think here the option 2 is the correct answer. And what's your opinion? Please type in the comment section, so I will also know about the answer. Okay. Then 20th question, which of the following is not included in the surgical safety checklist? So the options they have given: verify with patient name and procedure to be done, allergic check, medication check, counseling. I think you have seen the answer. So the answer option 4, counseling. Okay. Then 21st question, what is the name of the outer lip like structure that protects the entrance to the female reproductive system? So part, okay, anatomy. So what is the name of the outer lip like structure which protects the female reproductive system? The option they have given: hymen, labia, cervix, none of the above. So the answer is option 2, labia majora. Okay, 22nd question, which solution should be used to mop up the spilled blood on the floor of operation theatre? The options they have given: Sidex, sodium hypochlorite, Savlon, formalin. Which solution should be used to mop up the spilled blood on the floor of operation theatre? The answer, option 2, sodium hypochlorite. 23rd question, identify the post-renal cause of acute renal failure. So the options they have given: benign prostate hyperplasia, acute glomerulonephritis, heart failure, antihypertensive medications. This is already we have discussed in our previous video. What could be the cause of post-renal cause of acute renal failure? సెమినార్ ఆన్ అక్యూట్ రీనల్ ఫెయిల్యూర్ ఏమంటారు టాపిక్ నా ఛానల్లో ఉంది. జస్ట్ గో అండ్ చెక్ ఇట్ అవుట్. ఇన్ దట్ I have discussed the pre-renal causes and post-renal causes in detail. So here the option is 1, benign prostate hyperplasia. 24th question, the reason for polyuria is best defined as. So the option they have given: what's the polyuria's reason? So the lack of urine formation, diminished ability of the kidneys to concentrate the urine, passing too much urine at night, dark colored urine. How you are going to define the polyuria? The answer is 2, diminished ability of the kidneys to concentrate the urine. So the next 25th, ECG given below is of. So just you see the image of ECG and what it is. Is it atrial fibrillation, atrial flutter, sinus tachycardia, PSVT? The answer is option 1, atrial fibrillation.